Greetings, anatomy fans. It is I, Lissa Mahalik, somatic movement therapist, personal trainer, Pilates instructor, and sometime instructor trainer, and general anatomy nerd. Yes, I go to cadaver labs so you don't have to. And if you want to, oh, we should talk. Message me. I'll tell you the really good ones to go to. Anyhow, we're coming up on July 4th. You can see my lovely assistant Napoleon Boney Parts is getting in the mood. And today, this is day 2 of our 3-day preview of the Mind Body Anatomy Club. Now, the Mind Body Anatomy Club is this cool new project that I'm starting. I'm trying to organize and archive a lot of my anatomy teaching material, put it in that group, and add fresh material every month. So this month's fresh material is low back pain, right? Low back pain, it's a thing. Yesterday, we talked about some of the structures so that you can become aware of all the structures in your low back that can help give you support in the low back. Today, we're going to talk about some of the low back care myths and why they are wrong. Because the trouble with myths and false beliefs is that they get people distracted and they get people believing that this needs to happen to become healthy and happy and never have to worry about this again. And sadly, they can be really wrong. So let's talk and let's go into some of those myths. The first myth, and my favorite, is rest is good for the low back. Now, granted, when your low back is sore, it's not a day to go to Shaolin Kung Fu. It's not a day to go do gymnastics. It's not a day to go do your powerlifting. However, lying around and doing nothing actually makes it so much worse. It encourages weakness. It encourages bad habits. It encourages a lack of movement. And movement is what we need to keep our low backs healthy. This is really, there's some really interesting stuff coming up about this. I want to start talking about it. But I think that is, oh yes. And that is in, that's coming up in just a mo. So, like I said, rest, not necessarily good for the low back. Don't do your extreme stuff, but don't stop moving because it's really important to keep moving, to keep your body integrated and organized, right? Yesterday we talked about awareness. Today we're talking about organization. Another myth, surgery is, at some point you're just going to have to get surgery. When you have low back pain, you're going to have to get surgery. Actually, you don't. Necessarily. Like I said, I mentioned, I have had a stage 5 lumbar disc herniation, L5-S1 for all the nerds in the house. The jelly's out of the donut, it's floating around, it's causing havoc, but I have not had surgery on it. And I do train Shaolin Kung Fu. Next week, I'm going to ninja training classes. It's going to be awesome. Not like Japanese ninja, like American ninja. It's a whole thing. It's super fun. But it is not for the faint of heart or of spine. Because you don't need surgery no matter how, okay, I'm not going to say no matter how, but you don't necessarily need surgery. If you can use movement techniques, if you can work with what you've got, if you can organize your body properly, you can heal your body. I know I have done it, and I want to help as many other people do it, because the next myth comes up is surgery is going to solve low back pain. I get the surgery and then I'm fine. No, my friends, I know so many people who have had spinal fusions. And what happens when you have spinal fusions? So normally you have your spine, it moves like this. With a spinal fusion, you stop part of that moving. So now suddenly all these other things have to move a lot more to get the same range of motion and action. Now that becomes a problem because suddenly you are over-immobilizing the spinal joints above and below the fusion. Guess what? Your back pain is going to come back in those joints. You don't want to end up with a whole damn fused spine, right? Don't do that. Do not do that. So when you can use movement, use body organization, and not use knives to solve your back pain, you will end up with a longer term, more tenable solution. This is really, really, really important. Yes, there are some circumstances where, yeah, you're probably going to need the low back surgery, and that's a thing. However, people need it a lot less than they think they do, and I want to make that very clear. And I want to let people know, try this first. Try moving, try organization, because if you do not, you might miss out on a lifetime of much better body organization. And I'm talking to you guys with the clients. I know we've got a lot of Pilates teachers on this feed, and a lot of people come to Pilates for rehab because you guys are smart, because you guys know about anatomy, because you know how to organize the bodies, and frankly, because Joe, lunatic as he was also a freaking genius, and those exercises are really, really good for rehab. However, you're also going to need to know how to organize the spine and how to work with these things. So give people the chance not to have surgery is what I'm trying to say here. Another one, this is my favorite. Good posture will help your back pain, right? Right? That's what I've been saying, right? Organize your body properly, have good posture. Wait for it. Yes, now I'm standing up straight. Can I do this? I put a massive curve in my low back when I drop my chest and organize my spine. Now, see how my rib cage is now positioned over my pelvis? This is vital. And I will talk about this until the day I die, because people don't get it. People assume that chest lift, shoulders back, that is good posture. And no, they are wrong, because that puts your low back in the worst possible position for stopping low back pain. It is going to encourage low back pain. Your back will get worse if that's how you stand up straight. Not that you should slouch. That's also going to make your back worse. When you release your chest down and position your rib cage over your pelvis, then my friends, you are really, really, really going to get a release through the body, proper support of the low back. You can organize your body according to the support structures of your lumbar spine that we talked about yesterday, and the muscles will release, and it will hurt so much less. You will also not be re-injuring that site that is getting irritated by the bulging disc. It's a whole thing. I'm going to go so much more into that and go into specific cues and talk about how it all works on July 14th in the Mind Body Anatomy Club Facebook group. Sign up, join us. You're going to love it. And another one of my favorites is low back pain means you'll never work out again. Did I mention I train Shaolin Kung Fu, and that's after I busted the disc? You know, I'm going to American Ninja class. I go to the gym nearly every day when I possibly can. No, you know, it takes an excellent knowledge of mechanics, and it takes a super careful eye. And quite frankly, a lot of times it takes somebody looking from the outside. I go and get personal training from other people, because I want, when I'm doing hard stuff, I want somebody else watching me, because I'm concentrating on the inside, but I can't, these eyeballs are staying here. They're not coming out here and checking and seeing what I'm doing from the side. So that's where we as instructors come in. We need to train our eye. We need to train our knowledge so that we can safely work people out, so they can feel confident when they come to us that, oh, you know, yeah, I have this back issue. Yeah, my knees hurt. Yeah, this hurts. Yeah, that hurts. My shoulders are sad. And you can say, you know what? I know how to handle that. And I can say, you know, I feel confident and comfortable because I can see how confident and comfortable you are with this information. And you can be like on the inside, on the outside, you can be like, yes, I am confident and comfortable because I know anatomy. Right? So study anatomy, as Winston Churchill really should have said. All right, my friends. One more, and I'm going to toss this in, is that a strong core will prevent low back pain. As we talked about yesterday, what's your core, huh? What's your core? You need to know what your core is, and you need to be aware of it. But you also need not just to train your core, but you need to cross-train across your body so that you are actually integrating muscular systems. I'm going to talk about this a little bit more tomorrow because it's super fun and juicy. But if you are isolating the core, you are contributing to the problem. We're going to talk more about that tomorrow because it's fascinating and interesting. And I've been yammering on way too long today, my friends. So July 15th, the Mind Body Anatomy Club goes live with the lower back session. It's going to be great. You will not only get access to the live broadcast and the replay for as long as you like it, because I know a lot of you guys love replays. You guys are total replay watchers, which is fabulous, actually. I really like that. It's super fun. You will also get your questions answered personally. If you want to do that, you can ask questions. I will answer the questions, as I'm going to be popping in and out of there like popcorn. Because, hey, when you guys are interested and when you guys show me that you're really dedicated to improving your knowledge, helping your clients more, and being the best damn teacher you possibly can, I want to support that. I really, really do. So join the Mind Body Anatomy Club, www.somaticanatomy.com. Here's how you spell it. /register. And that is where you can get right in. If you just go to somaticanatomy.com, you can sign up from there too. But if you go straight to the register page, you'll just feel extra awesome. All right, my friends, get the anatomy info you need. I really want to help you get it because, as you might have noticed, I believe that if you understand the anatomy, if you understand the structure, that's when everything gets easier, more organized, less painful, more efficient. I could go on forever, but I'm just going to say enjoy your anatomy. I will be back this time tomorrow. Let's do it.